Good afternoon, everyone. Welcome, welcome. I'm seeing our participants rolling in here, so I'll give us all a couple of minutes to get into the session and for folks to get settled. Welcome to the Bridge Navigator Program information session. We're so excited to have you here and so excited to be talking with you today about the Bridge Navigator Program, and especially to go over the details of your Navigator program agreement with you. So we're just going to give it another minute or two while I introduce and set us up to give a few minutes for people to join. We're now at 80 participants, so very excited to be chatting with you about this today. While we're waiting and while you're hopping on, we would love for you to put your name in the chat, to share what hospital you're from, or hospital system or organization, where you're joining us from. As a heads up, this session is being recorded and it will be shared afterwards, shared out via email to anyone who registered, and it will be available on our website as well. So, so if you're not able to stay for the whole session, please know that you will have access to this information going forward. For anyone who needs the feature, closed captions are available, so you should be able to turn that on. And we're really excited to answer all of your questions today, as well as share some information out directly with you. To ask your questions, please use the Q&A feature. You'll see the Q&A feature at the bottom of your Zoom screen. Please drop your question in there. We have colleagues online today who are answering questions directly in the chat, in the Q&A. So you can look there for your answers. Don't put your questions in the chat. It's too hard for us to keep track of too many things. We can use the chat for any comments, but please use the Q&A for questions. And any questions that we don't answer directly in the chat will be answering live at the end of the session. We have reserved lots of time for Q&A in person. So you'll have a lot of opportunity to get your questions answered at that point. So with that, we have about 95 participants. Welcome again, everybody. We're going to go on to introducing our storied group of panelists here today. I forgot to introduce myself, of course. My name is Rosalie Dutta. I'm Chief of Staff for the California Bridge Program. You'll be hearing next from Dr. Andrew Herring, who's our Director and Co-Principal Investigator. He'll be sharing with you a general overview and background on California Bridge, our mission, our vision, and our model. After which you'll hear a little bit more in detail about the Bridge Navigator program, specifically from Dr. Serena Clayton, our Executive Director. She'll be talking about the Bridge Navigator program background. And then we'll turn it over to Elizabeth Woodford, our Finance and Contracts Manager, who will give you an overview of your agreement and of the exhibits that are attached to the agreement. She'll walk you through each of those. So just as a sort of orientation to agreements for the Bridge Navigator program, a lot of you here will not have received your agreement just yet. Please know that it is coming. If you have already applied, you should be hearing from us, and some have received your contract. So hopefully you have that in hand and can follow along. And then of course, we know that we have some of you present today who have not yet applied, and hopefully will be submitting an application. We are welcoming applications on an ongoing basis. So we are now accepting for the next round of funding. Our next deadline for applications is July 31st. So I know some of you haven't submitted your application yet, but you'll have a jump start on knowing what's in that agreement. So with that, I'll turn it over to Dr. Herring.
Wonderful. Thank you, Rosalie. I am thrilled to be here. Why don't we go ahead and move to the next slide? So the Bridge program is on this incredible program that is growing all over the state here, and our model is moving across the country as well. I'm seeing we've got a huge number of participants here, so this is incredibly exciting. Our basic goal, it's simple. We want to create 24/7 access to high quality treatment of substance use disorders in every single California hospital by 2025. We think this should be standard of care. We think it's common sense. It's good for all of the clinicians. It's good for the patients. It's good for society. It's something we should have done an awfully long time ago, and we're playing catch up. Next slide. Next slide. So this is the thing. When we first pitched this idea, like, hey, let's go to hospitals, let's work with hospitals and create this portal of entry. Let's identify folks in the emergency departments, in the inpatient wards, and connect them to care, initiate treatment, and develop this more integrated system that involves the hospitals. Initially, it was really kind of thought of like, oh, that's sort of a crazy idea. Hospitals are too busy. They don't care. They don't want to do this. And that's because many of the folks who were in charge just didn't understand how deeply most clinicians feel in the emergency department and the inpatient setting around the need to improve care for their patients who have substance use disorders. This is something that all of us deal with every single day. I was up all night in the emergency room last night. What proportion, how many of my patients are struggling with a use disorder? I mean, it's a half, more, 60, 70%. Some days it feels like the vast majority. So, and I know I'm not alone, and we wanted help. We wanted ways to turn our desire into something concrete to actually help people, and acknowledge that, look, we can't bring people the whole way. We need to create systems, create linkages that can make this work. So when you do that, when you put it together, it takes off like wildfire, which is what we're seeing, where we started with one hospital and then went to 5 and 12. And now we're way up there, over 160, with our goal of over 300. And we're going to get there. Next slide. So this is the basic model. This is the model that makes it actually work, pragmatic and functional. Is that there's the clinical champion, the sort of heart and soul of the person who's driving this forward, who has been in the trenches, so to speak, doing the work, and now sees this moment where they can do a better job for their colleagues and for their patients. And that person is paired with a navigator. And the navigator is there to form a relationship first with the patient. It's not necessarily contingent on eligibility for this or criterion for that. There's no exclusion. There's no like, oh, sorry, he doesn't qualify for the bridge program. We threw all of that out. We basically said, like, if you've got a use disorder, the navigator is going to form a relationship with you and figure out how to help you. Maybe that's a box of Narcan. Maybe that's a referral to a place to sleep tonight. Or maybe that's working through the details of starting buprenorphine for your opioid use disorder. All of that is sort of a choose your own adventure that is based and founded in a relationship. So when with that relationship with the navigator is then paired with the medical technology and ability of a clinician, there you can activate a whole new level of quality care that leads to better outcomes for the patient and reductions in really silly, needless reutilization, sort of hitting their head against the wall, going back into settings that aren't actually able to help them, really gets them to a place where they can receive the help that they need and want. Next slide. So the results have been staggering. No one predicted this was going to happen. No one around the country, I didn't. I don't think any of the staff thought it was going to go like this. So we've reached over 100,000 patients in the emergency departments and inpatients just in California. Nearly 100,000, 90,000 identified with opioid use disorder, which is the single sort of public health emergency that we're coping with right now in terms of driving early mortality of young people all over every single community in California and the United States, really. So this was happening at over 40,000 encounters where the concrete act of buprenorphine or methadone was actually prescribed. It wasn't sort of this gestural thing. We've all been through this sort of, regulations and stuff where it's sort of pro forma, like, phoning it in, like, did it really matter? No, this really mattered. If you get a buprenorphine prescription, if you get buprenorphine in your mouth, that really matters. That literally changes your mortality basically instantaneously. And that's over 40,000 visits. So it's something that we're incredibly proud of and something that we want to build upon. And we're so thrilled to have you all here to help us do that. Thank you. Next slide. With that, I'm going to pass it over to my incredible colleagues to take it from here. Thank you.
Great. Hi, everyone. I'm Serena Clayton. I'm the executive director here at California Bridge. And before we get into the nitty gritty of contracting, I'm just going to give a little bit more context about the journey that we have been on related to the funding, because it's a little complicated. There have been several phases and sometimes people get confused. So in 2018, California received federal funding from the feds, from SAMHSA, as part of what was called the State Opioid Response Grant. And at the state level, that money was administered by the Department of Healthcare Services, and a portion of that was awarded to the Public Health Institute and the California Bridge program. And we use these funds to fund 52 hospitals to launch ED-MAT programs along using the model that Andrew just described. So then there was a second phase of funding. And that funding came directly from the state general fund. And this is what was known as the Behavioral Health Pilot Project. Can you advance, Caroline, one more? Yeah, there we go. So under the Behavioral Health Pilot Project, the Department of Healthcare Services funded hospitals directly. So even though we at California Bridge were providing technical support and we collected data, we were not actually administering the funds. You had a contract directly with the state if you participated in that. And the Behavioral Health Pilot Project funded 200 sites at $100,000 each. So now we are fortunate enough to have a third round of funding. And I want to acknowledge the California Hospital Association, because we would not have this opportunity if it had not been for their advocacy. So this third round is what is called the CalBridge Behavioral Health Navigator Program. We are referring to it as the Bridge Navigator Program for short. And in this round, the origin of the funds is the Federal American Rescue Plan Act, or COVID relief. And in this case, again, DHCS has contracted with PHI, the Public Health Institute, and the California Bridge program to administer the funds, similar to what we did under SOR 1. So for those of you who have been with us throughout this journey, we're now going back to, that's why we're hosting this webinar, and this is going to seem somewhat familiar, although the contract is going to be a little bit different. So the eligibility for this program, and go to the next slide, is that all California acute care hospitals with emergency services, those could be comprehensive, basic, or standby, all those hospitals are eligible. The list is linked in the RFA, and it's the licensed healthcare facility listing. So if you're not sure if you qualify, please check that list. We anticipate funding 300 hospitals at $120,000 per hospital. So the timeline is that we're accepting applications in rounds. If you miss a deadline, your application will be considered in the next round. The deadline for the first round was May 31st. I'm guessing that many of you submitted by that date. If you didn't, you'll be considered in the next round. The last round is currently planned for January 15th, 2023. There is a possibility that the funds will be fully expended prior to that last round, so we do encourage people not to wait until the very end to submit. So that's the background, and now we're going to get into the mechanics of the agreements and the contracting. I'm going to turn it over to Elizabeth.
Thanks so much, Serena. I'm happy to be here to talk to you guys about the agreement specifics. So to start off with, we want to talk about a few definitions. Caroline, thanks. So we're going to be talking about subcontractors. This is the entity signing the agreement. This could be a hospital, hospital system, hospital foundation, or staffing agency. We'll refer to site. This is the hospital site where the work is being performed. And then we'll use the terms agreement, contract, subcontract. This is the legal document the subcontractor signs with PHI. As Serena mentioned, Bridge Navigator program funds are being subcontracted to our hospital sites and systems because PHI has the prime contract with DHCS. Next slide. So our agreement type is a fixed price and deliverables based agreement. It's a little unusual because you often think of state or federal funds as being more invoice receivable. This is going to be $120,000 per hospital, and payment is associated with the completion of deliverables and submission of invoices. There is no detailed cost reporting. This is a 1-year time frame. All deliverables must be completed within the contract period. Generally, it's 12 months. We'll be extending the first round of contracts to 13 months to allow some wiggle room as we need to get our contracts signed. Next slide. Just want to go through the agreement steps. The first step is the subcontractor's primary contact, authorized signatory, and contracting representative will receive the agreement from PHI directly. So please watch out. You're going to get an email from PHI, not California Bridge Program. And these primary contact, authorized signatory, and contracting representative are going to be those folks that you identified in your application. Then the subcontractor reviews, signs, and returns the agreement and associated required exhibits to PHI. And once that is returned to PHI, PHI will sign the agreement and send that fully executed agreement to the subcontractor. So next slide. The submission checklist. So when you submit your agreement, you're going to need to provide 4 things: the agreement with the signed cover page, the lobbying certification, contractor certification, which is 2 pages, and a subcontractor certificate of compliance. You'll also see in the agreement there's an exhibit F, and that should be returned with the phase 3 deliverables at the end of the program. So we're going to go a little bit more into all of these exhibits in a few minutes. So next, I'm going to talk about the exhibits in particular. So next slide. Exhibit A is the scope of work. This is so important. This is going to outline the deliverables, metrics, due dates, and outline which deliverables need to be completed by when. So please read in detail. Next, we have the payment schedule. So to receive the payments for phase 1 and 2, the subcontractor needs to complete the deliverables as listed, submit a deliverables online reporting form, and submit an invoice. For the phase 3 deliverables, phase 3 payments, the subcontractor must complete the deliverables, submit the deliverables reporting form, submit the invoice, and submit that signed exhibit F, the contractor's release form. All payments are going to be sent via check or ACH if the subcontractor opted in to using ACH deposits. Next, we're going to talk about exhibits C, D, F, and E. So all 3 of these are additional terms and conditions that are passed through from the state of California and the federal government. We, as California Bridge and PHI, need to adhere to these terms, and so we pass those down to our subcontractors as well. So all these provisions apply to your agreement unless they're suspended by an alternate provision or the applicable conditions don't exist at the subcontractor. Next, we have exhibits F, G, and H. You can advance the slide, thank you. So exhibit F is that contractor's release that you'll be submitting with your phase 3 deliverables. This basically confirms that all invoices have been submitted and PHI and DHCS's obligations to the subcontractor have been met. Exhibit G, it's 2 pages confirming the subcontractor is following California civil rights laws and other terms and conditions. And then exhibit H is the subcontractor's certification of compliance that you're not using grant funds for treatment with marijuana. Next slide. Okay, exhibit I is the fixed price invoice template. So subcontractors can use their own template or a system generated invoice, but there's specific instructions on what needs to be included in that invoice in your contract. So if you want to use your own format, feel free, but you have to comply with those instructions in the agreement. Just want to call out for some contractors, your contract has a travel reimbursement form for exhibit I. In all other contracts, we've removed and have the fixed price invoice template as exhibit I. So the first people who got their contracts, we wanted to make a change. So we'll fix that if as you send your contracts back. All right, so next, if you have questions, if you need help, if you have questions about your agreement terms, conditions, or exhibits, you can contact Margaret Welly, Senior Contract Administrator at PHI. And for all other questions, please reach out to Navigator Program at cabridge.org. So now I'm going to turn it back over to Rosalie for our Q&A.
Thank you so much, everybody. Thank you. Thank you, Elizabeth, for that detailed walkthrough. We are, as I said at the beginning, saving most of our time for any questions that you might have at this stage. So all those questions that you've been saving up, any reviews that you've been done, or anything that have been done of your agreement, or anything that you heard here today that you have more questions about, feel free to drop those into the Q&A section at the bottom of your screen. We have a couple of people on tap to help us out with Q&A as well from our colleagues over at the Public Health Institute. So we have with us Margaret Welly, our Senior Contract Administrator at PHI, as well as Nicole Tirado, who's our Deputy Chief Legal Counsel at PHI, and Pamela Andrews, our Grants and Contract Specialist at PHI. So everyone is here available, as well as the panelists that you heard from already can also answer your questions. So I wanted to make sure everyone has a few moments to collect their thoughts and any questions they might have. Please do drop those into the Q&A, not into the chat. We can answer them, some of them directly in the Q&A section right there in text, and other questions that might be more detailed or might need to be called out to one of our colleagues who's here to answer your questions. We'll answer those live. So I just want to give folks a moment to drop in any questions that they have or anything that's come up so far.
Rosalie, one of our first questions is, when will sites know or subcontractors know when they will be awarded?
Yeah, that's a great question. Elizabeth Woodford, are you available for that one?
Yeah, so we are, if you've submitted your application already, we are in the process of reviewing. If you haven't submitted yet, we are going to process applications as we receive them. You'll first receive a notification of award with a subcontract to follow a few weeks after that. So if you have specific questions about your application or contract status, if you could email navigatorprogram@cabridge.org. We are processing applications and contracts as we receive them.
Thanks, Elizabeth.
The next question is, how long is the contracting period?
Yes, exactly. Great question. The contracting period for the first round of funding is actually going to be extended to 13 months. So in general, the program has been designed as a 12-month program, one-year program. But as we're getting agreements out and to make sure that everyone's got enough time to complete their first, or actually rather it's the second set of deliverables there for phase 2 for those who have their scopes of work in front of them. We're going to be extending that time frame a little bit. So the first period will be first round will be a 13-month period. Going forward is probably going to be a one-year contract term. So I know that gets a little tricky because there's a variation, but if you have specific questions about your agreement, please do feel free to email us. That's just wanted to correct, the email address should be navigatorprogram@cabridge.org.
Thank you, Rosalie. The next question we have is, someone is asking that they have had changes since submitting their application. Will they be able to adjust their budget in the final agreement form when we submit?
Yeah, that's a great question. So if you have not yet signed your contract and you have planned anticipated changes to your budget, please do send us a updated budget as soon as possible. You should email us at the same address, navigatorprogram@cabridge.org, and we will review your updated budget. That's prior to the contracting phase. I want to clarify, once we've signed your contract, we are assuming and accepting your submitted final budget, and that as your plan. And following that, we will not be monitoring individual budgets. There's no cost reporting. So we anticipate that subcontractors will be completing their work according to their, they'll be completing their contract and fulfilling their contract terms according to the deliverables and spending their funding according to their projected plan and any adjustments that they may need to make in order to fulfill their deliverables. We're really looking at that point on deliverable completion and not at specific cost reporting.
We have another question that asks, does the contract need to be notarized? One page asks for state, county of execution.
Thank you. That would be a question. Nicole, can you answer that one? Or Margaret?
I'm going to defer to Nicole on that one. We haven't had that happen before where we needed a notarized copy, but this round may be different. Nicole, are you here?
Hi, this is Nicole Toretto. I'm Deputy Chief Legal Counsel here at PHI. First of all, I'd like to just give the disclaimer. I'm not providing legal advice to anybody. That's a really great question about the notary. I haven't heard that one before. Let me double check and we will post a response to that either in this chat or with a follow-up.
Thanks, Nicole. Thanks, Margaret.
We have another question asking about how do we know if our contract has arrived to the appropriate person? It's a new grant and many of us are on the list, but not sure if the contract was sent or not.
Yeah, that's a great question. Elizabeth, are you available for that one?
Sure. So the notification went to the primary contact, the contracting representative, and the authorized signatory at your entity, depending on whoever you put into your application. So whoever went into the application as those three people are the people who got the who received the notification of award if that's been processed yet. So I definitely encourage you to reach out directly to Navigator program at cabridge.org so we can look up your particular entity and see what the status is.
We have another question asking, will there be additional funding after the first year?
This is this funding is only for 1 year and it's for a 1 year program for each hospital. So while the program will continue to be implemented by additional hospitals for the next, I think, my gosh, my math is wrong, through March of 2024, each award and each contract is only for 1 year. There will not be future funding after this from this program, from this Bridge Navigator program.
It looks like we have a question about SAM registration. Someone said they submitted a request through the FSD back in early May and they still haven't heard back. Is there any way to expedite a SAM UEI validation?
Elizabeth, do you want to take that one?
Actually, do you mind if I hop in, Rosalind?
Yeah.
Or
Yeah,
Elizabeth?
thank you. That'd be great.
If you could reach out to Margaret or the Bridge Navigator program directly with your institution name, we can't unfortunately expedite it in terms of the processing of the UEI, but perhaps we can discuss, if there's another way to move the agreement forward. So if you could just reach out to the Bridge Navigator program and we will circle up and discuss how to make sure we can move your application forward.
Perfect. Thank you, Nicole.
We got another question asking that they already have an existing program. Can they use the funds to upscale the program by adding additional navigators?
Yes. So absolutely, really excited that you have already have an existing program and that you're eager to continue it. We do encourage you to use these funds to continue an existing program and continue to fund either an existing navigator or to bring on a new navigator. So absolutely.
Thanks, Rosalie. The next question is in regard to federal requirements. Someone is asking, are the federal requirements for accepting this money, are they able to be negotiated? If we don't have the capacity to comply with some of the federal requirements, should we not sign the agreement, or is there any flexibility?
Nicole, would you like to take that one?
Typically, the federal requirements are not negotiated. However, we're always open to hearing individual circumstances, but that's typically our stance. We don't, PHI itself doesn't really have a choice as to whether to flow them down. So that's the position that we are in. If I could just pop up real fast about the notary, I just did a quick review. I believe the person asking the question that's in relation to exhibit to the California Civil Rights Laws attachment. That's just a certification, that is not a notarization. So I just would like to clarify that. If there's a different certification or area where you see a notification, please let us know. But that's the only spot I could see in the contract or subcontract.
Thanks, Nicole. And then just to circle back on the question of the federal requirements and negotiability, I think would it be fair, Nicole, to invite anyone who has questions about a particular clause to submit those questions to us, so that we can be familiar with the issue and then also review the applicability of those clauses to our program?
Yes, absolutely. And they should also seek their own legal counsel as to whether they're applicable to their institution.
Okay, thank you. Thank you so much. What other questions are we receiving? Got lots of time to answer your questions today, so throw them at us.
There is a question in the chat that's asking, so after the first year when the program ends, the hospital has to cover the cost of continuing this program.
Sorry, can you repeat that question, Aiden? I'm not seeing it.
After the first year when the program ends, does the hospital cover the cost of continuing the program?
Yeah, that's a great question. Serena, are you available to talk a little bit about sustainability and planning for future maintenance of the program?
Yeah, absolutely. So we absolutely hope that after this funding ends, the hospital will find value in this program, will find value in the position of the Navigator, and will continue the funding for this program. We'll find a way to support the Navigator. We're going to be spending quite a bit of time during the first year helping people think about strategies for doing that. All of that said, of course, there's no actual obligation to do that. That is something that, given our mission to see this work spread across all hospitals in California, not as sort of a one-time, one-year thing, but as an ongoing change in the standard of care, we will do everything we can to work with folks to find ways to sustain the program. And at the same time, we'll also be looking at other opportunities to find funding at the state level that we might be able to access. But of course, there's no guarantees for that. So pretty much we're going to leave no stone unturned to help you make that a reality. But it's not a technical obligation of accepting the grant.
That's right. Thank you for that clarification. What other questions do we have?
We have a question asking, do you know the status of being able to bill insurance for Navigator services? We understand that this is under consideration for community health workers and wonder if the SUN will be covered under those legislative changes.
Yes, thank you. before you go too far, Serena, are you available?
Yeah, I
to-
can also answer that. So yes, based on everything that we understand so far, the new Medi-Cal certification for community health workers and the ability for providers to bill for community health worker services will cover the role, the position of the navigator and the type of services that the navigator is providing. We're tracking this really closely at the state level. We don't know yet what the reimbursement will be. We don't exactly know, like we don't know the dollar amount, we don't know the units of service. So we, we're advocating for policies that will provide strong reimbursement so that it does make the position sustainable through reimbursement. Obviously, it's going to depend on your particular hospital, how the navigator is employed. But I will say that the qualifications for a community health worker are well within the type of the role that we expect for a navigator. So there is a requirement to obtain a certification, but there's also a grandfathering in of people that have been working in the role. So it's quite broad. So we're pretty optimistic about this, and we'll definitely be updating people as we get more information from the state.
Thanks, Serena.
We have another great question in the Q&A that says, can you discuss a little further on next specific steps we need to take as frontline site people? First, alert finance to watch for and return the contracts. Then what specifically should we be doing as site personnel? Data, deliverables, etc.
Absolutely. That's a great question. Thank you. Oh, I just saw that the answer disappeared here. So yes, exactly. First, alert finance to watch for the contracts. Let's get those contracts signed. Once they're signed, we're going to be ready to evaluate your first set of deliverables. So we're eager to get you your first payment. And in order to receive your first payment, we need you to complete the first set of deliverables, which for folks who either if you don't have your contract, you can look on our website. We've posted the scope of work there, which has the deliverables laid out. If you were previously funded under the behavioral health pilot project that Serena was talking about earlier, you'll want to make sure that your data submissions are all up to date for completion of that project, all the way through the final submission, which will be by July 8th, as well as so once your data for prior funding is all caught up, we will be sharing with you a deliverables reporting form. So we're going to ask you to report on your updated team and ensure that confirm that your data is all up to date. Once you've submitted your completed deliverables form, we will be able to issue it along with an invoice, as Elizabeth was describing earlier in the first steps, for each deliverable, for payment of each deliverable. We will be able to issue out that payment. So that's going to be on the first set of deliverables, and simultaneously you'll be waiting to hear from our program team. So within the first period, immediately after the contract is signed, you're working on completing your new deliverables. You'll also then be hearing from our clinical program team, who will reach out to you. And Elizabeth Keating, if you're available to just wave hello and give a heads up for what's to come as the program gets started, that would be great.
Yeah, hi everyone. Nice to see everyone today. Lots of familiar faces on this call and lots of folks I'm looking forward to getting to know in the next 6 months to a year. So just to add on to what Rosalie said, after you do get qualified based on your first deliverables, you will be assigned an implementation leader through the California Bridge program, formerly known as regional directors, for those of you who have worked with us before. And this is mostly going to apply to folks who have never implemented a bridge program before. Those of you who are continuing ongoing problems, you will also be assigned an implementation leader, but they will continue to be more of just a helpful friend and coach as needed. Those of you who are new to the program will have some specific steps to take with your implementation leader. So Most likely that initial communication will come from me as the clinical program director, and then immediate follow-up will come from that implementation leader. And a good thing to do if you're just kind of sitting around at the hospital, tapping your feet, waiting to find out that this funding's come through, is to go ahead to cabridge.org and give a read to our implementation blueprint. So perhaps somebody can drop that in the chat for this webinar. But we have a really valuable resource called the implementation blueprint, which has a nice checklist in it, and it gives you a very solid overview of what we think a functioning program looks like. So something to do might be to read that blueprint, think about what you're already doing, maybe being inspired to get something started ahead of time. As you all know, these programs are very multi-stakeholder driven. So starting to think about talking to folks like your pharmacy department, talking to your ED director, just to say, hey, heads up, this is coming and I'm really excited about this particular aspect of the implementation. So you definitely can start drumming up that enthusiasm now. And again, if you're on this call and you have been implementing the program, I'm willing to bet you haven't looked at the blueprint in a while. So now's a really great time just to give it a read and think about, with this funding coming down, what are your opportunities to grow your program and make it even better? So that is what you can expect. We're excited to see what you all do.
Thanks, Elizabeth. Thanks for that impromptu teaser for what's to come ahead.
Rosalie, we have a question in the chat, which is, as the son, what am I responsible for?
That's a great question. Elizabeth, I don't think we have Sherry on the line today. Sherry, our Navigator program director, isn't here with us today, but Elizabeth, do you want to take that one?
Yeah, I'm happy to speak to that. So the most important thing that you're responsible for as a navigator is to help patients access treatment for substance use disorder. So we definitely hope that teams working on MAT programs will empower the navigator to have all of the resources that they need to support your program. And again, to give a plug for our blueprint, there is information on what that should look like. We're talking about things like making sure the navigator has a cell phone that patients can reach them on, making sure that the navigator has a nice place to sit where they're visible but comfortable within the emergency department. Making sure that the navigator knows folks in the ED, maybe making sure that they have access to things like printing and supplies for patient outreach. Beyond that, it's going to look pretty different based on every hospital. So some of the navigators are responsible for the data collection and submission for our programs, but in some cases that's handled either by a clinical champion or a project coordinator. So again, now is a really good time if you're a working navigator and you're curious what's going to shift as you embark on this continuation of the funding via the Bridge Navigator program. Now's a great time to sit down, meet with your supervisor, meet with your clinical champion, meet with the folks whose names were submitted for this application, and just think about what is going to be needed for this program in terms of getting the navigator staffed and also meeting those requirements such as the data submission every month. So could be you, could not be you, but I really implore all the navigators to focus on patient care first. We'll figure out the rest of the deliverables later.
Absolutely, thank you. And we've dropped in the chat. There are a couple of links that Elizabeth referred to. So do look there for the link to the blueprint, implementation blueprint, as well as the Navigator toolkit. Those are both links are in the chat there.
Yeah, I see a question, Rosalie, coming through the Q&A that says, do you have trainers that will come on site to train? And the answer to that is yes, absolutely. So that person who I referred to called the implementation leader, that is the person who's going to be available to come on site to train you. We are in the process of assigning those folks to the applications that are going to be in our first round, which is probably a lot of the folks on this call. And those people, pretty much the day that you get that email telling you that you have that person assigned, you should be able to set something up with them. Again, a really good thing to do at this point is to think about what that provider education is going to look like. So maybe you have grand rounds that only happen once a month, but they're scheduled 6 months in advance. Well, guess what? It's actually not too early for us to start thinking about education in November, December, January, whenever it is. Maybe you have a monthly departmental meeting where that agenda is set weeks in advance as well. Now's a really good time, whoever you are in the care team, to think about what the education opportunities are going to be at your hospital, and we'll staff any time slot you can give us.
Awesome, thank you.
Of course, look forward to meeting you, Christy.
I see a question coming in here from Mark about the, let's see, I'm processing here, for details regarding item 3 on the first set of deliverables, which is the reporting form. So the reporting form will be really the mechanism for you to submit the information that we're asking for in those deliverables. We will, of course, have a copy already of your fully executed contract. What we're going to be looking for is any, when we send to you the reporting form, will be any updated information that you have since the time when you submitted your application. And now that we're moving into the program work, the program implementation stage, we're going to be looking for updated contact information for your program team at your hospital. So if you already have a navigator on board, we need to make sure we have that person's contact information. We're looking for the clinical champion on board, who's going to be who are the different players who are going to be involved in your MAP program, the navigator supervisor, et cetera. We have a list of contacts that we would like to have updated so we can make sure that everyone on your team at your site is getting the information that they need from us, and that we're in touch so that we can work together and best support you. So we'll be sending you a reporting form requesting that information, and then we'll also be verifying that all of the data, the requirements that if you were previously funded under the behavioral health pilot project, will be confirming that your data has all been submitted. But the reporting form is going to be, especially for the first set of deliverables, will be really straightforward. It'll be sent to you. It'll be sent to you once your contract is fully executed. What other questions do we have? We have about 13 minutes remaining. So any other questions? Got a strong roster of people here available to answer your questions. Some of them researched live and answered right away. So give it another minute in case something comes up from what you've heard today, from what you've heard in some of the Q&A already. And then also please remember that you can, if you have a specific question with regard to your application or a particular clause in the contract that you've seen that you'd like to address, if it's a specific question about the contract itself, we encourage you to contact Margaret Welly, our senior contract administrator. Margaret's waving at us there. Excuse me. You should have her email address is in the email that's sent where you received your contract. But for those who don't have that email, Margaret's email address is mwhelly, MWHELLY @phi.org. If you have specific questions about the Navigator program or about California Bridge, please contact us at navigatorprogram@cabridge.org. So we'll always be available if you have questions about the status of your application. If you haven't gotten to that contract period yet, please reach the Navigator program. I also mention, I think the Navigator, yes, someone just dropped into the chat the link for the Bridge Navigator program information. So, if you go to our website, to the Bridge Navigator program page, you'll find a lot of helpful resources there, including the original RFA. You'll find the scope of work, which is part of the RFA and includes all of the deliverables that we've been discussing today, as well as a preview for folks who haven't applied. You'll find a preview of the application that you can review and the link to the portal to apply for funding if you haven't applied yet. All right, with that, we'll wrap it up and give you all 11 minutes back in your day. Thank you so much for joining us today. We're really excited to launch this program with all of you. And thank you especially to all of our panelists for taking the time to answer questions and be here, and looking forward to working with you all.